Hello, I'm Georgia Shakti-Hill, and I want to welcome you to Living in Balance. As part of our Healthy Living series, we're going to be talking about acupuncture. We're going to be talking about the basics, what it really is all about, why it works, the benefits of it, and when you might want to incorporate acupuncture as part of your health program. So, come join us. One of my friends recently attended a lecture at a local bookstore, and she said, "This fella is wonderful. If ever you want to know about acupuncture, you should have Todd Slaughter." So welcome.
Thank you, Georgia. Welcome.
And you're Dr. Todd Slaughter, and you are a doctor of Oriental medicine.
That's correct.
Okay. So acupuncture is your specialty?
It is. I practice acupuncture, which most people understand is the insertion of tiny needles at specific points on the body, known to have a desired effect. But that's really just a small part of what I do.
Oh, okay.
And what I do is really more properly called traditional Chinese medicine or Oriental medicine. And that includes acupuncture, but it also includes Oriental herbs and massage and diet and exercise and meditation.
So it's a whole way of life. It's a whole program of health.
It's a comprehensive healthcare system.
Okay. So traditional Chinese medicine or Oriental medicine.
Right.
Okay. And we're going to talk a little bit, and we're also going to differentiate a little bit between acupuncture and Japanese acupuncture.
Sure.
Okay. So we're talking Chinese and we're talking Oriental,
Right.
including the Japanese, the
That's
difference there too.
That's right.
Okay. Now, what I said I thought would be most beneficial is people have heard about it, and people are a little bit afraid of acupuncture unless they've had it. And I just interviewed a man who has walked around the world 33,000 miles, and how he keeps in shape is when he comes back home, he always has acupuncture. So it does work for him.
It works for the largest population in the world,
Okay, and that is?
the Chinese population.
Okay, so we're talking billions.
Yes, billions.
What is the history of it?
Traditional Chinese medicine probably originated in China, although recently they think it might have migrated from India and maybe even further west. But the first recorded history that we have of traditional Chinese medicine is, say, 5,000 years ago. And over that 5,000 years, there's been a lot of evolution in acupuncture and Oriental medicine, but many of the principles that were the founding principles of traditional Chinese medicine are still used today, and the diagnosis is still the same.
And allopathic medicine, or what we think is traditional Western medicine, that is 100 years old?
No, it's a couple of thousand years old as well,
okay.
but of course has evolved a lot. You know, it's rooted more in the Greek system than in the Asian system. But some of the principles of allopathic medicine were in existence thousands of years ago.
Okay. Why should I go to an acupuncturist? When might I know that it's time for me to look at myself from that perspective? Should I think of it as a new complete program, as you were talking about, or should I say, well, if I have this as an issue, perhaps acupuncture would be beneficial?
Certainly it can be a complete system of healthcare that in many cases could be an option, an alternative. But acupuncture works very well with Western medicine and also with chiropractic medicine.
Do you think of it as preventive or curative?
It's both. It has definitely a strong potential to prevent disease, and according to traditional Chinese medicine, this is the ultimate physician who can prevent disease before it starts, but it also has a very strong ability to cure disease. Many diseases, everything from the common cold to life-threatening illnesses.
Okay. Now, we do have one graphic of the placement of needles in a knee. Okay. And when we look at that, they have to be placed precisely.
That's right.
That's the important part, isn't
That's
it?
right.
Okay, so here, if we look very closely, there is a knee. We see 3 needles. Why might this patient be having this done as you look at this example?
Well, certainly this treatment could be for knee pain, and it's probably related to knee pain. The 3 points that were chosen there were some points that could be used for just about anything, but probably specifically knee pain.
Okay. Pain is what I understand many people who have tried everything else, then they'll turn to acupuncture.
That's right. Acupuncturists are commonly the physicians of last resort.
Okay.
And many of the diseases we get are progressed in nature. But many of the patients we get are just pain patients, and they come to us for pain.
Now, we do have a couple pictures of these meridians, which is very important for people to know as far as the placement. These little points that we see, would these be where a needle would be placed because it is a point on the meridian, on the line?
Right, these points in this picture are specific acupuncture points along the channels of the trunk, and there are also channels on the back and on the extremities. But those specific dots on that picture are specific acupuncture points.
Okay, so you have to memorize those. You have to know that you're smiling because that's just the basics, is it?
That is just the basics, but it's still quite challenging just to memorize each and every point. And you have to know more than really just the functions or the indications of that specific point. It's really necessary to know where the chi moves in the body from any specific point to any other specific area of the body.
Okay, so that's the whole flow of it.
Exactly,
Yes.
the flow of the channels.
Okay. Now, just so we differentiate here, are we going to be talking about Chinese acupuncture? Are we going to be talking about Japanese acupuncture? And what is the difference between the two?
The origins of acupuncture, as I said, probably started in China, but went to Japan long ago. And the foundations of traditional Chinese medicine and the foundations of Japanese acupuncture are the same foundations, but the practice is very, very different, and the tools that are used are very different.
Oh, okay. And as we think about that, but the points would all be the same?
The points are exactly the same.
Okay,
yes.
So that chart, or the chart that you brought that's a 3 chart, that would be appropriate for everybody, whether you're talking about the Japanese or the Chinese approach to the placement.
That's right. That's the standard diagram of the acupuncture points.
Okay. And that is the chi that is flowing. That's the concept behind all of this.
That's right.
Okay.
That's part of it. There's chi, and there's some other substances in the body that flow in the channels like blood, like other bodily fluids. But that's the basis of traditional Chinese medicine, is to restore the balance to the flow of the chi in the body.
Okay. And when the chi is blocked, we have a disease, or we have pain, or something goes wrong.
Exactly.
Okay. If it is flowing, then we're okay.
That's exactly right.
Okay. So, so you can get the flow going again.
That's right.
That's
what
the role.
acupuncture is all about.
Okay. That seems like that's pretty simple, but you have to know a lot about the premises behind all of that. I ask you to give us a little bit of information on, for example, Yin Yang, because that is balance. Our parts of our body, explain the Yin Yang as it relates to Chinese medicine or Oriental medicine.
Yin and Yang are fundamental philosophies to Chinese philosophy, and they are applied in traditional Chinese medicine to the internal organs and the areas of the bodies, and even the specific channels. 6 of the channels are yin, and 6 of the channels are yang. And they have different properties according to whether they're a yin or a yang channel. The translation for yin and yang is somewhere around yin meaning the shady side of a slope, and yang meaning the sunny side of a slope. And so everything that relates to coolness and quietude and the feminine energy and rest relates to yin, and everything that relates to activity and warmth and the masculine energy relates to yang. And so those two forces function in harmony in the human body to cool what needs to be cool and to heat what needs to be hot.
Okay, so if you're running a fever, your yang is way out of control,
Perhaps, yeah.
and you need to maybe add yin.
Exactly.
Okay, and then
Or
the
take
same
some of the
thing.
yang away.
Oh, okay. So you need to remove some of the heat, basically, of yang.
Right.
And so everything, though, food, for example, is either yin or yang.
That's right.
Okay. And so in medicines, herbs, and so forth, they will either be one or the other. And what we're then again is out of balance.
Right. The foods and the herbs each have their own specific tastes and natures and properties, which includes whether they're a yin herb or a yang herb, but also some other qualities like, for example, which channel they enter and which of the 5 elements they relate to. And when any of those things is out of balance, we can take food or we can take herbs or we can do acupuncture to restore those forces to harmony in the body.
Okay. We've come up again with another major aspect of Oriental medicine, and that's the 5 elements.
Right.
Okay, so things all fall into one of the 5 elements.
Everything in the universe,
Okay.
yes.
So everything is either yin or yang, and
That's right. And a lot of people know about, like, for instance, Chinese astrology, which is a part of traditional Chinese medicine. And when you go to the Chinese restaurant and you read your astrological forecast, that's only one aspect of who you are. The time of your birth also relates to either a yin time or a yang time, and also one of the 5 elements. Whether you were born in a time or a year that relates to fire, or relates to earth, or to metal, or to water, or to wood. And those forces inside the human body create an ecosystem. Just like your external environment, just like the world around you, those forces inside your body create a balance and an ecosystem that needs to be harmonious.
Okay, so we have all of those elements within, but is there a dominant one? Is that, or like, am I going to be parts of all 5?
Right, and ideally those would all be in perfect balance. But as you said, when qi becomes stagnated or out of balance in the body, we have disease. The same is true of the 5 elements and also of yin and yang. When they become out of balance, when one of those 5 elements is too much, more than the other ones, then that creates disease.
Okay. Well, I think so far you are really passing all these tests of all these questions. It's just like one right after the other. But really that's what we want to do today.
Right.
We want to inform, we want to educate.
Right.
And also we want to make people feel a little bit more comfortable with the acupuncture. And you're going to place a needle.
Sure.
For me, and we'll do that when we come back.
All right.
Okay. So Acupuncture 101 with Dr. Todd Slaughter. If you will stay tuned, we will be right back with more information for you. Welcome back, and if you are just joining us, we're talking with Todd Slaughter. He is a doctor of Oriental medicine. We're talking about the basics of acupuncture, and he has been very informative, and we're actually going to have a demonstration of it. But there's one thing you wanted to clarify. By statute, you can't say that acupuncture or Oriental medicine will cure a disease. What's the terminology that you're supposed to use?
We can certainly say safely that acupuncture treats many diseases and is considered safe and effective treatment by both the FDA and the World Health Organization for many diseases ranging from the common cold to gynecological disorders and many life-threatening diseases.
Okay. And it's used for everything from stress release.
That's
is
right.
one thing.
That's right.
And you have instruments now, and you said that, let's be clarifying here too. We have a display of instruments, and those are Japanese?
That's right.
Okay. The difference then, now as we look at them here, how are they different from the Chinese?
Many of those, the basis for those instruments is Chinese. From thousands of years ago, the original 9 shapes of the needles, but they've been modified in ways that are used only in the style of Japanese acupuncture. And today, even the needles themselves are different, whether they're Chinese or Japanese. The shape of them and the size of them is different.
Do you have a preference?
Yeah, I tend to practice more Japanese acupuncture.
Okay. And you like then the shape of those?
Yeah, and the patients like the Japanese acupuncture a lot. It tends to be perhaps more painless than the Chinese acupuncture.
And you're going to do one on
Sure.
me. Okay. And you're going to show us the basic, the most known spot on the body
this
for release
acupuncture-
of pain.
That's right. This acupuncture point that we've chosen is called large intestine 4, or the Chinese name for that is hegu. And it's commonly used to treat headaches or even facial pain, or in tooth extraction or dental anesthesia.
Ah, okay.
So it's a very common point.
All right, and people, okay, now this one is stainless steel, and you swore.
This one's actually sterling silver.
Sterling silver,
Right.
okay. But you promised that it's
That's right.
absolutely sterilized.
That's right.
Okay. Because what you're using now, most of the time, are
Disposable needles, and this
Right.
is a disposable needle.
Oh,
So
okay.
after I use this one time, then I'll have to discard it, and that's a statute in the state of Florida that all acupuncturists must use only disposable needles.
Oh, okay. All right, so we're
So you
using.
ready?
Yeah, I'm ready. Okay. And I'm not supposed to scream or yell or anything.
So this, even this one point may be chosen in a treatment of headaches, just to use even just this one point would make up a whole treatment.
Oh, okay.
Okay. So it's so simple and it's quite
Yeah,
painless.
and that was no big deal at all. Now, how long would it stay?
It's treated according to the disease. So for some diseases, it might be retained only a couple of moments, and then for some diseases, maybe up to half an hour or more.
Okay. Let's say you have a patient or client who comes in, and they have, for example, something that is very serious, like a cancer or something like that. Would you put needles all over their body? Would there be just that one meridian that you would treat? How do you approach that?
Well, since you specifically mentioned cancer, I think most beneficial to the patient to work in cooperation with Western medicine in the treatment of cancer. Western medicine has a lot of very effective means for treating cancer. So then, according to the patient, points would be selected, and they may be just local points, or they may be points all over the body, according to the patient and according to the disease.
Okay, what if we had something like an arthritis, which is ongoing?
Right, and certainly that would
Chronic.
We would use both local points to the pain, as well as points all over the body that would treat at more a constitutional level and treat more the origin of the pain and not just the joint pain, not just the inflammation of the joint, but the causative factor of the arthritis.
Okay. Now, we're done?
Yes.
Okay. Well, I didn't have a headache and I still don't, so I'm just fine.
Wonderful.
But it didn't hurt a lot. I mean, it was just, I felt it, but not hardly at all.
Right.
Okay.
Most people will equate it to a mosquito bite.
Yeah. Now, however, I have had it done before and you'd asked me, and one of the things went into my toe, and that was painful. So are we more sensitive in certain areas than others?
Certainly areas that have more nerve endings will be more sensitive. And also, according to your disease, certain areas of the body will be more stuck or more stagnant, and those areas of the body will be more painful.
Oh, okay, so that's an indicator in itself.
Right, exactly. And even in Western medicine, they use specific points on the body to palpate them and then to determine the cause of the disease or the nature of the disease according to the points on the body which are tender. And this is an ancient practice.
Well, as you said, we're looking at the Chinese medicine at 5,000 years old. Okay, so it is really tried and true. And what I'm finding is I have friends who have been studying acupuncture. I mean, this is something that to me is very popular now. Have you seen an incredible trend toward it being more accepted in the West?
Oh yeah, in the last few years, acupuncture has gained a great popularity. And in the last couple of years, the FDA has reclassified acupuncture and, as I said before, considers it safe and effective treatment for many diseases.
Okay.
And in fact, next year there's a bill, or this year, there's a bill coming before the national legislature for Medicare coverage on acupuncture. And I would encourage all of your viewers to contact their state representatives and help get this Medicare bill to the floor.
I agree. I really do, because I think that we should have the opportunity to choose. Right.
Exactly, and that's what the bill's all about, guaranteeing each person who's covered under Medicare the right to choose therapies, including alternative therapies, including acupuncture.
And just recently, one of the huge HMOs has included complementary medicine in quotes. And what terminology do you like to use? Alternative? Or
I like complementary medicine because I would like to see both acupuncture and Oriental medicine working side by side with Western medicine, and not as much an alternative to it, because each of those systems of medicine has a lot to offer the patient, and if they're used together, it can be very beneficial for the patient.
And also the terminology integrated medicine.
Integrated medicine,
yes,
I like as well.
That's been used. Now, one of the things that you brought was a wonderful display of herbs. Okay, now tell us about Chinese herbs. Have this reputation for just being phenomenal, but also exotic. What did you bring? What do we have here?
So I have some angelica and some herba ephedra and some magnolia flowers. All of these herbs are used to treat diseases. For example, the common cold. All of these herbs may be used to treat the common cold. And Chinese herbology is such an advanced system of medicine, and it's more not the herbs themselves that come from China that have any different properties, but the way in which they're used. They're not used like many people use Western herbs just for symptom relief. So if you have a cold, you go and you get some echinacea or some golden seal. They're used according to the patient and according to the syndrome and according to the imbalance that occurs in each individual to treat at the root, to treat the causative factor of the disease and not just the cough or the sniffles.
Well, I know there's a tea, Bogenmi tea, that I have had, and it's sold here, and like the potency that I have purchased it is just for anyone, it would be fine. Right. But if I went to you, you would look at each of those ingredients specifically for me, and you could personalize it.
Right, and I would encourage all of your viewers, if they're going to use any kind of herbs, whether they're Chinese herbs or Western herbs, to consult a physician. And probably the best trained physicians in herbs would be physicians of acupuncture or Oriental medicine, because that tea, the Bogenmi tea, may be fine for you, but it may not be exactly the best thing for you, and it may even cause you to become not as healthy as you are now.
So we can't just think of herbs as being fine. They have side effects, or they can be used improperly.
They have effects, and sometimes, as we said before, you may be operating where you're too hot. And those herbs may be warm herbs, and as a layperson, you might not understand that. But when an acupuncturist does your diagnosis, and he takes your pulse, and he palpates these acupuncture points or meridians, and he looks at your tongue, and he asks you questions, and he listens to how you answer those questions, he can determine whether you're too yin or too yang, or whether your fire is out of balance or your water is out of balance. And then he can prescribe those herbs according to your state and bring you back to a state of balance. So it's not that the herbs are dangerous or have side effects, but that a warm herb causes your body to become hot. And you might not know if your body's hot or not in the first place.
Okay. And I liked the method of diagnosis, and I think that's really fascinating. And it is, you take the pulse, but you take the pulse at different levels. I mean, you feel it at different levels or something. It's not just a straight pulse.
According to traditional Chinese medicine, there's 6 pulse positions on each of the hands. And those 6 pulse positions relate to each of the 12 channels. And so by taking the pulse at those 3 different positions superficially, and then 3 different positions deeper, those relate to each individual channel, and the acupuncturist can determine which channels are out of balance or which organs are out of balance.
And you also mentioned the tongue. Now that's always fun, because I did get to see the Book of Tongues.
Oh, right.
that is used as part of the diagnosis.
Sure.
And that's kind of fascinating too. So this is a study that is unique, is it not? I mean, to Oriental medicine?
I think that traditional Chinese medicine is the only system that uses a tongue diagnosis. That's right. And the tongue can present so much about, as I said, the inner ecosystem, because the tongue stays inside most of the time, but then you can stick it out and it shows you what's going on inside the body. And it tells you what's happening with each organ and with the various substances in the body. And it's an invaluable tool for diagnosis.
Okay, so those are the 2 main methods of diagnosis, the pulse and the tongue.
And also asking questions, listening to how the patients answer the questions, and also looking at the patients.
Okay. Well, I really appreciate your sharing Acupuncture 101 with us. It has been very beneficial. And there may be people who would like to be in touch with you, and also who might be interested in studying acupuncture. So if you will stay tuned, we'll let you know how you can find Todd Slaughter. And also, we always love to hear from you. The basics, Acupuncture 101, that's what we really did today. And we hope that it will help you to live in balance. That's the whole concept, so that your chi will flow. So if you can live in balance in mind, body, spirit, until next time, I'm Georgia Shakti-Hill. May you be well, happy, and peaceful.